Tummy ache before a big game, a sleepless night after an argument with the best friend. Kids' stressors are just as much a part of life as adult stressors. The key difference, kids don't yet have the skills to deal with them. But as Channel 8's Macy Jepsen discovered, some are getting help by helping themselves.
Competitive soccer, battling for good grades, dance recitals, and pressure from parents and friends. Kids are busier than ever and under more stress than ever. And there are consequences.
We're seeing a generation of children that are more to themselves, that are more internal and keep to themselves.
Child psychologist Rusty Lozano says kids aren't mature enough to talk about stress. They keep it in, but it manifests itself in stomach problems, sleepless nights, headaches.
I typically just walk straight up here to the third floor with a blanket and a pillow.
17-year-old Eric Demmer suffers migraine headaches.
The whole left side of my face goes numb and droops down as if I've had a seizure.
He was hospitalized for 5 days in April. Pain pills had given him ulcers. His mom was desperate.
As a mom, to sit there and watch your child in pain constantly just breaks your heart.
Eric's pediatric neurologist sees it all the time and refers patients to a psychologist.
I can't fix everything with a pill.
Here's where Lozano comes in. He teaches kids how to think their pain away with something called biofeedback.
For children, it's making the connection between what those physical sensations mean.
Here's how it works. Pain in our body is triggered by physical changes we can't see, but when hooked up to a biofeedback machine, a computer display can show a patient what it looks like. The peaks here are showing stress. The machine measures blood pressure, body temperature, or heart rate, and experts say controlling breathing and using pain simulation techniques can reduce stress and pain.
When you see physiology or signals on a biofeedback screen increase or decrease, it means something.
Seeing was believing after Eric's first session.
This is where he starts to use his techniques.
They actually cause heat, to be introduced into the area.
And look at his peripheral body temperature.
And by allowing that heat to be introduced in the area, it relaxes those muscles around those capillaries that are constricted.
The result?
He's actually going into a controlled state of relaxation.
If Eric masters the technique, he'll return to school next year after 5 months of homeschooling.
I'll be trying everything, as hard as I can, and I'll hopefully stay in school all next year. No, not hopefully. I know I will stay in school all next year.
Macy Jepsen, Channel 8 News.